Hey, how are you? Yeah, so I'm your physician today. Yeah, I believe you have read all the procedures actually before coming to meet me. You met my nurse, right? Okay, perfect. So, are you nervous? You're nervous. Don't be. Please calm down. I mean, like, you're not here because you're forced, right? You're not here because you're forced. You want to do this, right? Yeah. Don't worry. This surgery is very much safe. Don't worry, we will not change anything. We just fix you. Okay? Alright, so alright, can I start now? I mean, before we go to the procedure, I would like to, explain to you some of the, maybe some questions that you want to inquire, or maybe something that you're really curious about. So I would like to say that to you. Yeah, okay. First, you might be thinking that whether I am or this hospital is qualified or not, right? Of course, you're wondering. Yes. This kind of thing you can ask me about whether I'm qualified. I can show you my certificate as a physician. Yes. Do you have any doubts about that? First of all, no? Okay, great. Alright, so perhaps you might be thinking also, is the facility here licensed and accredited, and are emergency procedures in place? So let me explain to you. If you have a surgery outside of a hospital, then at an outpatient facility on our office here, be sure it's licensed. Of course, it's licensed, as you can see. Even my nurse outside also show it to you beforehand. I mean, before you met me, right? Yeah. So if you have any doubt, you can always ask me. You're most welcome to ask it. And let me inform to you that we have accredited to the Association for the Ambulatory Health Care, and also the Country Association for Accreditation of Ambulatory Surgery Facilities. Okay. And we do have this facility also has medications, equipment, and procedures in place to handle emergencies, especially if there is no emergency facility nearby. So you don't have anything to worry. Yeah? Alright, for the next questions that I believe you might be wondering, who will provide the anesthesia? Alright, so for the anesthesia care will be led by anesthesiologist, so you don't have to worry about that. An anesthesiologist is a medical doctor who specializes in anesthesia, pain management, or in critical care medicine, and works with your surgeon, with me obviously, and other physicians to develop and administer your anesthesia care plan. So everything is settled, okay? They usually closely monitor your anesthesia and vital functions during the procedure, and take care of you after to assure your recovery is smooth and your pain is controlled. Alright? Okay. Next question that you might be wondering. Will you be healthy as you can be? Okay. Spend some time before the procedure being as active as you can, eating right and getting good sleep. If you smoke, do you smoke? Of course, you do not smoke. People who smoke, they should stop as soon as possible, even if it's just a day or two before surgery, because smoking can cause problems with breathing and recovery from anesthesia and surgery. Other steps you can take will be guided by your meeting with the medical teams, including the anesthesiologist. So after this, you're going to meet the anesthesiologist. All right? Okay. This one might be very important for you, yeah? How do you avoid surprise medical bills? Okay, let me explain to you. While your health and safety are your priorities, it's also important to make sure your insurance coverage is in order before surgery, so you don't receive any unexpected bills. So everything is covered, right, from your part? Okay. Surprise medical bills are caused by surprise insurance gaps that occur when your insurance plan offers a low premium but limits the number of physicians in the plan's network. And before having a medical procedure, you can also ask who will be involved in your care and whether they're in your plan's network. Call your insurance company to verify that the hospital or medical center and each physician and provider caring for you are in network. So I believe you have done that before. And this hospital is in your range, right? Perfect. Perfect for that. All right. When you meet later on with your anesthesiologist, there are some questions you can ask. I'm going to give you tips and tricks here. Okay, so you can ask about your health habits. You can explain to them about your health habits and medications. You can tell them all about your health, such as how physically active you are, and if you have chronic health issues such as asthma or other lung problems, diabetes, heart disease, liver or kidney disease, allergies, or any other medical conditions. Be sure to mention if you snore or have other sleep problems. These may be symptoms of obstructive sleep apnea, which can make surgery and anesthesia more dangerous. So provide a list of all prescription and over-the-counter medication, supplements, and vitamins you take. Your anesthesiologist might tell you to stop taking some of them. Yeah, you can go ahead and tell them after you meet me. The next thing you can tell them your use of alcohol or recreational drugs. All right, the use of recreational drugs such as alcohol, marijuana, narcotics, or stimulants should be discussed. These substances can affect how you react to anesthesia and the type of and amount you need. You're not using anything, you don't drink. All right, perfect. And you can also mention to them about your experience with anesthesia. Tell your anesthesiologist if you or a family member has had a bad reaction to anesthesia or pain medication, and make them aware of any anesthesia side effects you experienced, even if they occurred years ago. Did that happen before? Yes? All right. Also mention if you ever had a stroke or had experienced heat stroke. You can also explain that to them. Yeah. And also, please also discuss with them your fears. It's natural to fear surgery in anesthesia. If you're afraid, tell your anesthesiologist, okay? They can give you information to ease your mind and help you feel safe. That will help, yeah. And bring written questions to your meeting. If you have some questions out of this, you can also ask them. Yes, of course, you can ask them anything, if any doubts you have. Write down the answers, because it's difficult to remember everything you hear. So when your anesthesiologist explains something, you can write it down, or maybe you can just put a recording or something like that. It's allowed, yeah. Or maybe bring a friend or family member who can take notes and ask questions, as well as provide information you may not have thought of. You can also discuss with your friends or family members about this. Yeah, and also you can talk to your anesthesiologist that you can continue to care for your surgery after surgery. So ask about how any pain will be managed and any concerns you have about recovery, returning home, and getting back to your normal routine. Yeah, some people can take more time to heal, just because, different people, different, sort of healing capacity. Yeah, so is there any more questions you would like me to explain to you? No? All right. Okay, one last explanation. I would like to inform you that what should you expect right before surgery? Okay, as the day of the procedure arrives, plan to follow pre-surgery directions and diet. So unless you're having only local anesthesia, you may be told not to eat or drink anything after midnight before your procedure. This is because of the rare risk of food or liquid in your stomach getting into your lungs while you're under sedation or general anesthesia. ask your anesthesiologist for guidance. You may be told you can drink clear liquids and take your regular medications. And bring a friend. You won't be allowed to drive after outpatient surgery or even after a few days in the hospital if you're taking pain medication. Plan to have someone take you home, a friend, a family, whoever. And then wear comfortable clothing. Wear or bring loose-fitting clothing. Your body might be sore or swollen from surgery, or you may have bulky bandages over your incisions. Leave jewelry and valuables at home. Yeah, it will help. All right? So I believe this information can help you go through a surgery. Yeah. If you have any more questions, and you can always come back to me. Right now, you have to meet your anesthesiologist for further procedure. All right? You don't have to be, nervous about this, as I inform you. All right, you're in a good hands. All right. Okay, bye. Good luck then. Yeah, bye.